From the moment you walk in through the door, you will sense that this is not your everyday ordinary medical practice. In every corner of our facility, you will see our number one value reflected, that prevention is better than cure. So join me as we tour the multifaceted facility and meet the staff who keep the heartbeat of our practice strong.
Welcome to Cardiovascular Interventions, Central Florida's premier cardiology practice. We're located at 1900 North Mills Avenue in beautiful Lake Helen in Orlando. Our 12,000 square foot facility houses the most technologically advanced collection of modalities to help make your visit to CVI a comprehensive one. As if that's not enough, Florida Hospital, which is the world's busiest cardiac care facility, is just steps away. Here at Cardiovascular Interventions, we believe prevention is better than cure. Our warm and personable staff is dedicated to instilling confidence and support as you transition to a more heart-healthy lifestyle.
EECP is a non-invasive treatment for patients who have angina or chest pain. Angina, of course, is the chest pain that patients experience when they have blockages in their coronary arteries. EECP is safe and effective and has no significant side effect. EECP has been available in my practice since 1994. I embrace this technology because it's non-invasive and it's safe and it is effective. Of course, the alternative would be angioplasty, bypass surgery, or stent placement. But EECP not only improves angina, but the patients also improve psychologically and emotionally. But it also improves the quality of life. There's less chest pain, emotional benefit, and the same benefit one would get from receiving angioplasty. Part of our commitment to excellence in health is to provide comprehensive classes in our office and on the road on various aspects of lifestyle changes, free to the public, patients, family, and friends. Some of these topics include stress management, weight management, and exercise. Practical information to implement into your life today to not only improve your health, but also to improve quality of life. Tremendous strides have been made recently in angioplasty and in the treatment of coronary artery disease. I've been performing these procedures for about 15 years. But more important than that, it's who you do it on and when you do it. Well, we're going to get started and see if there's any blockages in your arteries of your aorta. And I'll give you a little bit of Novocaine. You shouldn't feel much discomfort at all. And in a few minutes we'll get started and you'll feel a heart feeling, okay? So here it comes. Feel a little bit of discomfort. Shouldn't be much discomfort at all. There you go. We're going to see the arteries and hopefully this shouldn't take too long. We'll put a little stent in there. And there it goes. Looking really nice. That stent here is looking nice. We have beautiful case selection is most important. So my judgment and background experience combined with the lifestyle changes that we are advocating, we hope to not only modify the disease process now, but for the future also. Put the stent inside now. We're going to inflate the stent. Here it comes. Looking good. Wonderful. This is really nice. We're getting a very good result. Excellent. But I think this is going to wrap it up. Looks good. Thank you. Our nuclear lab at Cardiovascular Interventions has the state-of-the-art dual-head system, which gives the most accurate nuclear stress tests. Now the question is, why are they necessary? They're necessary because not every blockage needs an angioplasty or bypass. Based on the results of the nuclear stress tests, we can pick out the patients who really need an angioplasty or who really need bypass surgery, or we can follow the progress of a patient. High-quality nuclear stress tests are an integral part of the management of patients with heart disease. The results of a high-quality nuclear stress tests allows me to design a medical program specific for the patient, combined with the lifestyle modification program of the kind that we offer at Cardiovascular Interventions. And together, we can not only improve the medical prognosis, but improve the quality of life too. One of the breakthrough technologies in the last 5 years are pacemakers and implanted devices. Now these include ICDs, which are implantable defibrillators, pacemakers, and biventricular pacemakers. Now of course these are implanted in the hospital, But once implanted, they need follow-up in the office. Close adjustments are made to the devices as we interrogate them in our pacemaker clinic. And through the magnet, we're able to adjust your device to work at maximum efficiency. And of course, you want the battery to last a very long time. Some of our patients have the convenience of trans-telephonic checks from home. They only need to come into the office once a year for checkup. Our pacemaker clinic has the highest, technologically most advanced computers to monitor these devices and follow the patients closely. My approach to a healthy cardiac diet is a very down-to-earth, sensible diet. What this means is looking to see what kind of a medical system do I have to digest food. Now, if you think about it, our genes have not changed in the last 100,000 years. Yet the type of food that we are consuming today is so different from the food that our grandparents ate. So my approach is to try to replicate the type of diet that we should be eating based on our genetic makeup. Going back to nature, eating the way our body was supposed to eat, avoiding things that are prepackaged and processed. And I always tell my patients this joke that, look, when you go out to the farms, you don't see packages growing on trees, you don't see boxes on bushes, and we don't see soda streams. So we want to get back to basics, eating foods that are given to us by nature, fresh foods, fresh water. This is what our body requires for nutrition, not the processed foods of convenience that we have today. We will show you how to make a practical approach to this. We advocate at least half an hour of vigorous activity every day for everyone. Now, sometimes some patients can't do that much exercise, then we give them a special program that suits them. But they must exercise. Some form of exercise is extremely important. It's not only important for them physically, but it has great mental benefits as well, and stress management. So it all rolls in. You've got to look at the whole picture. It's not just your body, it's your whole lifestyle, from thinking to acting to feeling and behaving. It's the whole thing. It's how you think, it's how you feel, it's how you behave, it's how you walk, it's how you exercise. It's the whole thing that's going to affect your health. We believe in this type of a holistic approach, high-tech with complete lifestyle management.
If you haven't already heard, Central Florida is the heart capital of the United States. You've got a plethora of choices for cardiovascular care. We're grateful that you've chosen Cardiovascular Interventions and Dr. Pradip Jamnadas. Here at Cardiovascular Interventions, we're passionate about our work because we're passionate about life. So therefore, we're passionate about